Good afternoon, all, and welcome. You are listening to another special episode of Respire, One Voice at a Time. Respire, a joint initiative taken by NATCO and Voice of Healthcare team. Respire, you all know, this is a podcast series navigating the journey of a lung cancer, lung health, and also oncology related to lung cancer. Lung cancer is most common and remains one of the leading causes of the cancer-related deaths in India. So there is a lot of misconception, myths, and gaps to understand what actually lung cancer is. So, so it always falls under the shadows of focus and expertise. So it always. So today we have Dr. Nadeem Shoket, Senior Consultant Medical Oncologist from AOI, Jammu and Kashmir, to throw some light on the vital aspects of lung cancer awareness. And also, welcome, Doctor. It's always been pleasure to invite you on this
Thank you.
Respire platform, sir. Thanks for your valuable time.
Thank you.
Okay. Should I start, sir?
Yes, please go ahead.
Okay. So coming to understand the burden, what is lung cancer becoming more common in non-smokers also, sir?
See, previously what every one of us used to think that whoever is a smoker, he will get the lung cancer, and a non-smoker will never get a lung cancer. But it's not like that. Non-smokers do also get a lung cancer, although there are multiple causes for that. I mean, causes in the form of, like, there can be even passive smoking. That also constitutes a risk for a lung cancer. And besides that, there is an environmental exposure, say in the form of asbestos and cadmium, and then there are some nickel and some even this air pollution secondary to this burning of a diesel. So that is also considered one of the. And besides that, even genetic. I mean, many a times we get to see the lung cancer even in runs in the families. There can be genetic preponderance also. So even non-smokers do also have a risk to get a lung cancer.
Okay, sir. So thanks for explaining all the risk factors also, sir. But how is the trend, sir, in India? The incidence is increasing of lung cancer.
Yes. Uh, I mean, the incidence of lung cancer is definitely, increasing in spite of, I mean, there is a good amount of a campaign against the smoking, although, smoking has quite a lot reduced. But yes, still the lung cancer incidence is, still the same. So the reason behind that is it can be, and this environmental pollution also. I mean, besides that, I mean, there are some unknown, radioactive substances even in the soil. And even in our building materials, whatever is being used, so there can be some radioactive sources, and those can be the reasons for this continuous this occurrence of a lung cancer. And moreover, if we talk about the type of a lung cancer, say, histopathology type, typically what we used to see that smoking related this squamous cell carcinoma, it used to be previously common, but nowadays non-smoker related adenocarcinoma, that is relatively getting more commoner than that.
Okay. Okay, sir. So to understand about the diagnosis, sir, or screening, uh, is it so important for early detection of lung cancer, sir?
Yes, see, how important it is to understand to detect early. One can understand from this fact that majority of our lung cancers are diagnosed at a stage 3 and 4, where it is most of the time incurable. Although, modern therapies have prolonged the lifespan of a lung cancer patient, even being in a stage 4. But and how that if the patient is diagnosed as stage 1, stage 2, most of the time it can even get cured. And you see, the main curative option for a lung cancer treatment is the surgery. But unfortunately, if we talk about roughly in out of 100, hardly in our scenario, it is hardly 8 to 10 patients who are able to get the surgery. So, majority people are just land up with chemotherapy only, or some people land up with, in addition to that, radiotherapy and targeted treatment. So unfortunately, the surgery, which is the curative option, that is only available just for very few number of patients. So this is the reason, why we should be, very vigilant, and this is the responsibility of our general practitioners also, and being of a general public also. Whenever they find that any symptoms like this continuous cough which is not resolved by taking antibiotics. And even if somebody is diagnosed as a tuberculosis previously, what used to happen that I have seen many of the patients who have been wrongly labeled as tuberculosis just on the basis of X-ray and taking ATTs, and later they turned out to be a frank lung malignancy, frank lung cancer. So it is, I mean, a really important. I mean, in the nowadays era when we have this CT available everywhere. I mean, whenever somebody is not settling down, his chest infection is not settling down, his X-ray is not normalizing. It should definitely be investigated. It may be even a first presentation of a lung cancer.
Rahul, is it okay? Any disturbance is coming while Doctor Sir is talking?
No, I'm able to hear your voice very normally, and
Is it fine, Doctor
I
Sir?
hope
From Doctor Sir, and
I'm
it is
also
any disturbance signaling? Rahul, is it fine? Now it is fine, sir. Some disturbance was there earlier when we were talking about diagnosis.
okay.
Okay. Okay, sir. Anyways, you have explained clearly why early detection is so important in lung cancer. But to understand, sir, nowadays the diagnostic tools like low dose CT scans, getting availability, accessibility of this quite be difficult. So, so they are accessible, sir, now in tier 2,
Nowadays,
tier 3 cities.
yes. Nowadays, if you look at the scenario, I mean, if I talk about the particularly Jammu and Kashmir, even in a district hospitals, government have installed those CT scans. And another important thing is that many a times there may be apprehension from the, general public regarding the this radiation exposure. But if you talk about the screening CT, which is being employed for this lung cancer screening, it is a low dose CT and it doesn't involve the usage of a contrast. And in this, we predominantly try to study this lung anatomy. And here the
Rahul, can you see the doctor or hear the doctor?
Doctor video is off actually, I think.
yes. So next question. Next question.
Sir, what are the signs and symptoms which should not be ignored by the patient? General signs and symptoms or what?
Sandeep, you are not audible.
Sir, when you talk about symptoms, symptoms should not be ignored by the patient?
You are not audible.
Rahul, you are audible.
No.
Rahul, you can hear my
Yes,
voice.
yes, I
Yes.
can hear you and I can hear Dr.
Sir, I
voice
was
as well.
asking about the symptoms, sir.
Oh, okay.
What signs and symptoms should
Yes.
never be ignored by the patient?
Sandeep, you're not audible. I mean, to me.
One second, sir. I'll rejoin.
Sandeep, we can proceed to next question.
Okay, sir. Some disturbances are coming. Okay. So I was talking about the symptoms which should not be ignored by the patient.
Symptoms which should not be ignored by the patient is that unsettling cough. I mean, even after taking a course of antibiotics, and somebody having a weight loss, somebody having a continue this blood in the sputum, and then chest pain, continuous chest pain, which even has been evaluated by ECG and everything. So these can be some early symptoms of the lung cancer. And many a time there can be patient can present with a stage 4 symptom. I mean, there will be no symptoms pertaining to chest. Patient can straight away present with symptoms secondary to metastasis. Metastasis means, I mean, the cancer has already spread to other parts like brain or some other body part, and there are symptoms secondary to it. But most of the time the early symptoms which can, I mean, this unsettling cough, chest pain, continuous blood in the sputum, so these are the common symptoms which shouldn't be ignored.
So, anyways, when you're talking about diagnosis, you somewhere you highlighted upon the treatments. But still, sir, how does you think, as your expertise into this, last 10 years or last 20 years, how the lung cancer treatment has been evolved
See,
in
previously
the last
what
decade or last 20?
Yes, previously the approach was one shoe fits all, but nowadays the approach is not like that. I mean, there is a tailor-based treatment. I mean, every patient behaves differently. Every patient is to be given a different treatment. So it all depends upon the. I mean, a lot of molecular evaluation is to be done extensively. I mean, when the patient is diagnosed, and then accordingly we try to give the treatment. And those particularly we try to find out a targeted target, and that target is to be I mean exactly this hit by a particular drug. And using those drugs have really made a remarkable difference in patients' lives. I mean, in terms of survival, definitely yes, survival has tremendously increased, and besides that, the quality of life has extraordinarily increased. I mean, those other side effects, they have almost completely gone off. And moreover, since the introduction of immunotherapy, I mean, that also has been a big boon for the, I mean, this oncology patients. And particularly if you talk about the lung cancer, I mean, I have seen patients who have been surviving for say 2 3 years easily, that too with an extraordinary quality of a life, with no dependence on any other caregiver, and they are taking immunotherapy continuously. So I mean, these are some of the things, I mean, which really needs to be highlighted, and which gives a sort of a positive outlook for a general public to this dreaded disease.
Okay, sir. Okay. You have talked about molecular analysis and those therapy should be targeted. And, sir, but still, can you throw some light on this immunotherapy also, sir? What is
uh,
immunotherapy and
yes,
how does it helping lung cancer patients?
Mm. The immunotherapy, basically, the idea of immunotherapy is that it tries to stimulate the body's own immune system against the cancerous cells. So normally what happens whenever somebody gets a cancer, it is a sort of a immune escape. I mean, there are sort of a I mean, those cancerous cells, they develop kind of a escape mechanism by which they are able to evade the immune system. So what immunotherapy does, that after administration of those drugs, they try to break down those signals and rather encourage the body's own immune system to attack those cancerous cells. So with immunotherapy, the good thing has been that most of the time it has been seen that it is very much tolerable. I mean, this can be easily taken. The only problem with immunotherapy has been found to be is the cost, and nowadays even that has also been taken care of because of the introduction of a multiple generic molecules, and the cost has definitely come down a lot. So I mean, that day is not far away when we will get to see that every patient, I mean, is able to afford it.
Okay, sir. Sir, how does you plan personalized treatment for different types of lung cancer, sir, as per the stages?
Yes, personalized treatment is, I mean, whenever the patient of lung cancer comes to us, the first thing that we do is that we try to find out the what is the exactly stage, and then we try to find out what is the histology. I mean, what is his biopsy report, and then accordingly we ask for the tests, and then accordingly we demonstrate a plan for the concerned patient. I mean, whether this patient goes for a surgery or not, whether this patient goes for a radiotherapy or not, and if none of those options are feasible in that scenario, whether this patient will go for a immunotherapy, targeted therapy, or just conventional chemotherapy. So that all depends upon the, I mean, baseline workup.
Okay, sir. And sir, as we are in India, once again the point strikes is accessible. How far these treatments are accessible and affordable to the patients? One thing. And second, sir, what are the major barriers to assess quality care in India, sir? Quality cancer care in India,
See,
as
to
per
be very
your
honest with you,
expertise, sir.
yes, I mean, nowadays, yes, it is in the reach of definitely a common man's reach has also, I mean, this cancer treatment and particularly lung cancer treatment. But still, there is a lot of an unmet need in the treatment of this cancer, particularly if you talk about the immunotherapy, because our huge population is the one that lives below the poverty line. And moreover, if we look at the, I mean, the if we talk about the experts, I mean, if the expertise is not available rather, if we say that in every district of the country, rather, I wish that there should be a someday, I mean, when we do have a I mean, cancer expert available in almost every district of the country. Because if you look at the burden of the cancer, I mean, the way it is growing, I mean, that day is not far away, I mean, when it will be as common as diabetes or hypertension. And I mean, maybe that you people will also agree to this fact, I mean, how the cancer is coming up.
Okay, sir. And sir, what advice would you give to the patient who is coming from small town? Once again, I'm asking this question. Who want to navigate the treatment of lung cancer? Very small town or very village background kind of thing. What advice you give, sir?
The advice is that I mean, in India we have a trend of I mean, self medication. So self medication is to be discouraged as much as possible. Don't take your symptoms for granted. So whenever you feel there is anything wrong with your body, just consult your local doctor only. I mean, it's not necessary that you consult a cancer physician or a cancer surgeon. Consult your local doctor only. So whenever the doctor, I mean, and moreover, just follow one doctor only. I mean, if that symptom or that problem doesn't settles down, go again to him. And if he feels okay, previously I gave him this kind of a treatment and he hasn't improved, he will definitely try to investigate it, what is the cause why he is not improving. And in case he finds out any abnormality, he will immediately refer you, and then only you step into the bigger cities for a further treatment. And moreover, most of the time the treatment is time taking. You have to be a little bit patient, and with the, I mean, concerned cancer physician or a cancer surgeon, and then do follow whatever advice he says. And moreover, till date, I mean, unfortunately, in our Indian scenario also, good population is the one who follows, I mean, those quacks, and who expect that there will be miracles in, but it doesn't happen in oncology. I mean, we have seen patients, and even unfortunately those who had a curative malignancies, I mean, we have seen patients that they succumb to those curative cancers.
Okay. Okay. And sir, cancer is not, and to say the word itself, entire family gets offended by listening to the word once, because it's affect the cancer word. It affects the entire family, not only the single person. So the psychosocial impact will be more, no sir. So how does you tackle those kind of patients or the mental health of those kind of patients?
I mean, very true. I mean, once somebody has been diagnosed with a cancer, it not only impacts the concerned person, it impacts the whole family. I mean, there is a physical as well as economic burden in both ways. I mean, and it's really important that we should have an adequate amount of a counseling at the outset only. I mean, at the diagnosis only. I mean, what are the expectations? What is the future course of action? And how many turns, how many visits will be there in the hospital. So, and these all, I mean, has to be said in a absolutely, I mean, black and white. I mean, and there should be no extraordinary expectations also. I mean, many a time people do expect that, okay, this will get cured, and they try to sell off their even belongings also. I mean, yes, this is really important. The person should be counseled beforehand only. I mean, say this is a stage 4 cancer, there can be I mean, just palliation of the symptom, there can be just prolonging of the life, it cannot be cured. So I mean, that part has to be that part is really important, and that has to be made clear at the outset only, because many a time we have seen people, I mean, they lose from both ends, economic as well as, I mean, the health end also. So I mean, this is really important.
Okay. And sir, uh, one mean to say, based upon your experience, what are the most common misconception myths you have heard from the patients? Biggest myth.
The biggest myth I feel, I mean, that applies to almost every cancer is the biopsy. I mean, whenever we get to see a lung mass, the next step is that we ask the patient to get a biopsy, and the patient, many a time we have seen they categorically refusing that. Yes, we know that if the needle is introduced into the tissue, it will spread, but it is not like that. People say that if the needle has been introduced into the tissue, it will spread, but it is not like that. I mean, the biopsy is really, really very important, I mean, for the labeling someone with a cancer. And even I have seen instances where I asked for a biopsy, and it ultimately turned out to be an infection only. It wasn't even a cancer. So one cannot treat cancer just on the basis of a suspicion, just on the basis of a CT or a PET CT. Biopsy is important, and nothing can replace the biopsy.
Exactly, sir. Exactly, sir. And sir, one strong and powerful message for our audience who are listening today about lung cancer.
Sandeep, you are not audible again.
Sir, one, if you could share one powerful message with the
Sandeep, you
public
are not
about
audible.
lung cancer. Hello, sir. Now you can hear. Rahul, can you hear me?
Yes, I can hear you.
Ah, yes, now it's
Ah, just, sir, can you hear
again. You are
Rahul,
not
sir?
audible.
Sir, can you hear Rahul?
Sir, can you hear me?
Ah, yeah, patient. Patient. I think we can end up now because patients
Yeah,
are
we can end
waiting.
up, sir. One strong, powerful message.
Sir, he is asking for a powerful message for the audience.
The
Rahul,
most
can you ask
important
once from Thomas?
message for the audience is, give up the self medication, and moreover, the identifiable risk factor is the smoking, and avoid that. And besides that, those who are already smoking, they should undergo this screening CT. That those who are in the age group of 55 to 77 years, they should undergo low dose CT every 3 years. So this is all what I want to say. Thank you.
Okay, sir. Thank you, sir. Thanks for your valuable time and thanks giving your message through this platform. Thank you very much, sir.